Today we're going to talk about ankylosing spondylitis and specifically how this condition is diagnosed. So first off, what is ankylosing spondylitis? Ankylosing spondylitis is an autoimmune disease which is best known for causing back pain and stiffness. It most commonly occurs in young men, but men and women of any age can have ankylosing spondylitis. And again, while it most commonly occurs in young men, that's when symptoms usually begin. Once it starts, unfortunately, it continues through life. While there is no cure, treatment options for ankylosing spondylitis have improved over the last couple decades, and there are very good therapeutic options that are available these days. Ankylosing spondylitis doesn't cause any back pain and causes what's called inflammatory back pain, which is different from what we think of as normal back pain, which is more mechanical in nature. And I think that deserves to talk about a little bit to differentiate between inflammatory back pain and mechanical back pain. So some general rules that one can follow to differentiate between those two. So inflammatory back pain usually has a younger age of onset, like we talked about. So usually it'll be less than 40 the first time that happens. Whereas mechanical back pain certainly can happen at any time, but more common as we get older than 40. Inflammatory back pain usually comes on slowly over time. Doesn't have to, but often more than not. Whereas mechanical back pain, usually it's acute. It wasn't there, something happens, and then you have that pain. Mechanical back pain usually is short-lived, so most people have pain, it gets better. That's not the case for everyone, but for the most. Whereas inflammatory back pain will last longer. It's not going to necessarily resolve on its own. So we certainly start to get more concerned more than 3 months of having those sorts of symptoms. The other big difference is inflammatory back pain is worse in the morning. It's associated with morning stiffness felt in the back, usually more than 1 hour, whereas mechanical back pain, you may be stiff when you first get up, but it's typically 30 minutes or less. Similarly, inflammatory back pain usually you can experience at night, whereas that's usually not the case for mechanical back pain. Mechanical back pain, when you don't use it, it doesn't hurt as much, whereas for inflammatory back pain, it's actually quite the opposite, where when you don't use it, it actually may end up hurting more. So similarly with exercise, getting moving may actually help inflammatory back pain, whereas it exacerbates mechanical back pain. Inflammatory back pain can be associated with extra articular features. What this means is that you may have symptoms, may have other conditions that are happening outside of the joints. So with ankylosing spondylitis, you can have things with eye involvement, back involvement, skin involvement, and so forth. Whereas mechanical back pain, because it's just the mechanics of the back that are causing trouble, that would be very unusual to happen. With inflammatory back pain, usually there are not neurological nerve problems, possible, but very unusual. Whereas mechanical back pain, again, not common, but sciatica, which is beyond what we're talking about here, but is a common term used, can happen with mechanical back pain as the mechanics change and put some pressure on a nerve in the back. So those are kind of key differences between inflammatory and mechanical back pain. How is ankylosing spondylitis diagnosed? Well, a good history, so having your physician, rheumatologist talk to you to try to get a sense of how they feel that pain. Again, is it inflammatory or mechanical? A physical exam is going to be important. There may be blood tests that are associated with this as well. We'll talk about that in a moment, as well as imaging tests, so radiology type investigations. When it comes to blood tests, there really isn't anything specifically diagnostic for ankylosing spondylitis. So you may have markers of inflammation in your blood, which may be elevated. They're not specific, though, for ankylosing spondylitis. There's lots of different causes that they may be up, and you may have ankylosing spondylitis with normal markers of inflammation. So certainly it helps for the picture, but it is not diagnostic. As well, ankylosing spondylitis is highly associated with a genetic marker called HLA-B27. More than 90%, so not all, but the vast majority of patients who have ankylosing spondylitis will have this genetic marker test as positive. However, it's important to know that a lot of people have this marker and will not have ankylosing spondylitis. So again, it is not a specific test to make that diagnosis. And you can watch one of our other videos to learn more about how this test is used. But it's certainly not a commonly necessary test to make a diagnosis. Imaging is important. Classically, x-rays particularly of the lower back, the sacroiliac joint, looking for signs of inflammation are used. These days, an MRI test looking for inflammation can be even more helpful and is often done for our patients. So between a good history and imaging, often a diagnosis can be made. While there's no cure for ankylosing spondylitis, like we said, there are a growing number of excellent treatment options which reduce pain and stiffness and improve day-to-day function. Please feel free to visit our website at albertarheumatology.com to learn more about the various treatment options for this condition, as well as many other diseases and conditions in rheumatology.